You're sitting in your doctor's office, exhausted. You can barely make it through the day without needing a nap. Climbing stairs feels like climbing a mountain. Your muscles ache, your energy is gone, and you feel like a shadow of your former self. The doctor looks up from your chart and smiles. Good news. Your blood work looks great. Everything's normal. But you don't feel normal. You feel terrible. So what's going on? How can your tests say you're fine when you feel so weak? This is the hidden crisis affecting millions of seniors right now. And today, we're going to uncover exactly why this happens, what your doctor might be missing, and what you can actually do about it. Because here's the truth. Normal blood tests don't always mean you're healthy. They just mean you're not sick enough to set off alarm bells. There's a massive difference. Let's start with what your doctor is actually testing. Most routine blood panels check for things like complete blood count, basic metabolic panel, thyroid function, and maybe vitamin B12 if you're lucky. These tests are designed to catch serious disease, not subtle decline. Think of it like a smoke alarm in your house. It only goes off when there's already a fire. It doesn't warn you when the wiring is slowly deteriorating, when there's a small gas leak, or when your electrical system is being overloaded. By the time that alarm screams, you already have a serious problem. Your standard blood tests work the same way. Let's take thyroid function as an example. Your doctor checks your TSH level. If it's between 0.5 and 4.5, they tell you it's normal. But research shows that many people feel their best when their TSH is between 1 and 2. If yours is 3.8, you're technically normal, but you might be functioning with a sluggish thyroid that's draining your energy every single day. The same goes for vitamin D. Your doctor might say 30 nanograms per milliliter is sufficient, but optimal levels for muscle strength, immune function, and energy are closer to 40 or 50. You're not deficient enough to be diagnosed, but you're not thriving either. Here's something most people don't realize. As we age, our bodies need higher levels of certain nutrients to function at the same level. Your normal might have been perfect at age 40, but at 70, that same number means you're running on empty. Now let's talk about what's probably not being tested at all. Vitamin D is sometimes checked, but what about magnesium? This mineral is crucial for over 300 biochemical reactions in your body, including energy production and muscle function. Up to half of older adults are deficient. But doctors rarely test for it because the standard blood test doesn't accurately reflect your body's magnesium stores. Most of your magnesium is inside your cells, not floating in your bloodstream. You could be severely deficient, and your blood test would look perfect. The same problem exists with iron. Your hemoglobin might be fine, but what about your ferritin, which measures your iron stores? Low ferritin causes crushing fatigue, weakness, and brain fog, but it's often overlooked because your basic iron numbers look acceptable. Then there's inflammation. Chronic, low-grade inflammation is one of the biggest causes of weakness and fatigue in older adults. It's called inflammaging, the slow burn of inflammation that comes with aging. But unless your doctor specifically orders tests like C-reactive protein or homocysteine, this invisible fire goes completely undetected. And here's the kicker: muscle loss. After age 50, you lose about 1 to 2% of your muscle mass every year. This is called sarcopenia, and it's a major reason why seniors feel weak. But there's no muscle mass measurement in your standard blood panel. Your doctor can't see that you've lost 20 pounds of muscle over the past decade unless they're specifically looking for it. Blood tests measure what's in your blood. They don't measure what's in your muscles, your mitochondria, or your cells where the real action is happening. Let's dig deeper into the energy problem. You know that feeling of being tired down to your bones? That's often a mitochondrial issue. Mitochondria are the power plants of your cells. They turn food into energy. As you age, Your mitochondria become less efficient, and you produce less cellular energy. But guess what? Standard blood tests don't measure mitochondrial function. They don't tell your doctor that your cellular batteries are dying. Nutrients like CoQ10, which is essential for mitochondrial energy production, decline with age, especially if you're taking statin drugs for cholesterol, which deplete CoQ10 even further. But doctors almost never check this, and many don't even mention that statins can cause muscle weakness and fatigue as a side effect. Now let's talk about hormone levels. For women, estrogen and progesterone decline after menopause. For men, testosterone gradually drops. These hormones aren't just about reproduction. They affect muscle strength, bone density, energy levels, and mood. Many doctors will test these hormones, see they're low, and say, well, that's normal for your age. And technically, they're right. It is normal. But normal doesn't mean optimal. Just because everyone your age is experiencing hormonal decline doesn't mean you have to accept the weakness and fatigue that comes with it. There's also cortisol, your stress hormone. Chronic stress, poor sleep, and inflammation can dysregulate your cortisol patterns. You might have too much cortisol at night, preventing deep sleep, or too little in the morning, leaving you exhausted. A single morning cortisol test won't capture this daily pattern. You'd need a 4-point saliva test throughout the day, which most doctors don't order. Here's another huge factor: medication side effects. Older adults often take multiple medications, and many common drugs cause fatigue and weakness as side effects. Blood pressure medications, antidepressants, antihistamines, proton pump inhibitors for acid reflux, these can all sap your energy. When you're taking 5 or 6 medications, the interactions can amplify these effects. But your blood tests won't show this. They'll just show that your blood pressure is controlled and your symptoms are managed. You're trading one problem for another, and nobody's connecting the dots. Let's talk about sleep, because this is massive. Poor sleep quality is epidemic among older adults. You might be in bed for 8 hours, but only getting 5 hours of actual restorative sleep. Sleep apnea, restless leg syndrome, frequent urination, pain, these all fragment your sleep. When you don't sleep well, your body doesn't repair itself properly. Your hormones get disrupted, inflammation rises, and your muscles don't recover. But your blood tests in the morning look fine because they're not measuring sleep quality or recovery. Dehydration is another silent culprit. As you age, your sense of thirst diminishes. You might be chronically mildly dehydrated without even realizing it. This affects everything: your blood pressure, your kidney function, your energy, your mental clarity. But unless your dehydration is severe, your basic metabolic panel might not flag it. And here's something that will surprise you: gut health. Your gut microbiome affects nutrient absorption, inflammation, immune function, and even mood through the gut-brain axis. If your gut isn't healthy, you're not absorbing the nutrients from your food properly, no matter how well you eat. But there's no standard gut health marker on routine blood work. Your doctor isn't looking at whether you have leaky gut, bacterial overgrowth, or an imbalanced microbiome, all of which can cause systemic weakness and fatigue. So what can you do about all this? First, become an informed advocate for yourself. When your doctor says your tests are normal, ask specific questions. What were my actual numbers? Are they optimal or just not diseased? Can we test my vitamin D, magnesium, ferritin, B12, and folate levels? Consider asking for a more comprehensive thyroid panel that includes free T3 and free T4, not just TSH. Ask about inflammatory markers like C-reactive protein. If you're taking statins, ask about CoQ10 supplementation. Second, focus on what blood tests can't measure. Assess your muscle mass. Are you weaker than you were 5 years ago? Can you get up from a chair without using your hands? Can you carry groceries without struggling? If not, you need to address muscle loss regardless of what your blood work says. Start resistance training. This is non-negotiable. Lifting weights or doing bodyweight exercises 2 to 3 times per week can rebuild lost muscle, boost your metabolism, improve your energy, and increase your functional strength. Study after study shows that it's never too late to start. Third, prioritize protein. Most older adults don't eat enough protein, and this accelerates muscle loss. Aim for 25 to 30 grams of protein per meal. Greek yogurt, eggs, chicken, fish, beans, these should be staples in your diet. Fourth, optimize your sleep. Create a dark, cool bedroom. Limit screen time before bed. If you suspect sleep apnea, talk to your doctor about a sleep study. Quality sleep is when your body heals and restores itself. Fifth, move your body every day. Walking, swimming, yoga, anything that gets you moving improves circulation, reduces inflammation, and boosts energy. Sitting is the new smoking, and sedentary behavior accelerates aging faster than almost anything else. Sixth, consider targeted supplementation, but do it smartly. Work with a knowledgeable healthcare provider. Vitamin D, magnesium, CoQ10, omega-3 fatty acids. These can make a real difference if you're deficient. But don't just randomly take supplements. Test, supplement, and retest to see if it's working. Finally, address the root causes. If medications are making you weak, talk to your doctor about alternatives. If chronic stress is driving inflammation, find stress management techniques that work for you. If your gut is unhealthy, work on healing it with probiotics, fiber, and whole foods. The bottom line is this: you are not crazy. You are not just getting old. If you feel weak and exhausted despite good blood tests, something is off, and you deserve answers. Your blood tests are a snapshot, not the whole picture. They're a starting point, not the final word. True health isn't about hitting arbitrary numbers on a lab report. It's about feeling strong, energized, and capable of living the life you want to live. Don't settle for being told you're fine when you know you're not. Keep asking questions. Keep advocating for yourself. And take control of the factors you can influence: your nutrition, your movement, your sleep, and your mindset. You have more power than you think, and you deserve to feel strong again.